Okay, so I did my presentation on federally qualified health centers, and I was inspired to do this topic because I interviewed a lady named Janine Peterson, who is a CEO of a federally qualified health center, and I really enjoyed the healthcare setting that I saw when I did my executive interview for her. So I decided to make that my topic. Okay. So with that said, I hope at the end of this presentation, you'll be able to, one, understand what federally qualified health centers are through definition and who, what, when, where are federally qualified health centers used. And number two, explain what it takes to be a federally qualified health center. So learning objective one. Federally qualified health centers are outpatient clinics that qualify for specific reimbursement systems under Medicare and Medicaid. Federally qualified health centers typically offer services to all persons, regardless of a person's ability to pay, and provide comprehensive primary care service, and is a nonprofit or public organization. So where/when is this used? Federally qualified health centers are meant to provide comprehensive health services to the medically underserved to reduce the patient load on hospital emergency rooms. So their mission now is to enhance primary care services in underserved urban and rural communities. So basically, they're mostly used in areas that lack medically professional. Health professionals, and is medically underserved. And who commonly needs this? Federally qualified health centers provide comprehensive primary care and preventive care to persons of all ages, regardless of their ability to pay or health insurances. And federally qualified health centers are called community/migrant health centers, or 330 funded clinics. Funded programs serve migrant and seasonal agricultural workers, homeless individuals and families, and residents of public housing. And this link right here sends you to a video about Fox News about how federally qualified health centers are helping people within the community, which I will not show currently. But what is the benefit of knowing this? It is important to know about federally qualified health centers because as a person interested in investing or working at a health system, you will find that hospitals tend to affiliate with federally qualified health centers to help solve problems in access and payments and provide specialized and high-risk services. It also decreases hospital losses from avoidable emergency visits. So the learning objective 2, explain what it takes to be a federally qualified health center. And federally qualified health centers are commonly known as a community health center, CHC, and as a primary care center that is community-based and patient-directed. And as a CHC, some basics of it is typically is located in a medically underserved area or area that has health professional shortages, and is governed by a board of directors who are from the community, and majority must be a health center patient who represents the population served. It also provides comprehensive, high-quality primary care as well as helping individuals get access to health care. It provides services available to all with sliding fee scale based on the ability to pay. So, federally qualified health center billing. From a billing perspective, federally qualified health centers are reimbursed on an all-inclusive model under Medicare and Medicaid, and they must use a sliding scale to to give discounts based on patients' family size and income in accordance with the federal poverty guidelines. So next is just some graphs that show how much non-elderly adults receive care from a federally qualified health center and how many of them have a family income at or below the 138% of federal poverty line. And, people who live within 1 mile of a federally qualified health center, 13.7% of them are non-elderly, and 22.22% of them have a family income below or at 138% of the federal poverty line. And you can see that's the highest out of compared to those who live 1 to 5 miles from a qualified center, or who lives more than 5 miles from a federally qualified health center, which makes a lot of sense. And this graph right here is just more in depth about it just breaks down the ages and sexes and races, just demographics of those who relied on a federally qualified health center in the past year or year 2014, and who did not rely on a federally qualified health center. So the ones who did are in the light blue, and the ones who didn't are in the grayish color. So just an overview of the learning objective 1, some main points to remember is that federally qualified health centers are community-based organizations that provide comprehensive primary care and preventive care to persons of all ages, regardless of their ability to pay or health insurance, and that they serve migrant and seasonal agricultural workers, homeless individuals and families, and residents of public housing, and that they're very important to health systems because they affiliate with them to help solve problems in access and payments. And some main points from Objective 2 was federally qualified health centers receive funding under the Section 330 of the Public Health Service Act by HRS, and they're usually located in a medically undeserved area. They use a sliding fee scale for pricing and are reimbursed on an all-inclusive model under Medicare and Medicaid. So some questions, just 3 questions just to refresh your mind. So number 1, federally qualified health centers are a community-based organization that provides preventive care and primary care to persons blank regardless of their ability to pay. And as I said, it's really all ages, so that the answer would be D. And number 2, federally qualified health centers receive funding under what of the Public Health Service, and that's the Section 330. And health systems tend to blank with federally qualified health centers, and they tend to affiliate with them to, as I said, to help solve access and payment. And thank you for watching this video. Please comment below, subscribe if you want to. Yes, thank you once again, and have a good day.